And joining us from his home in Cedarville, Ohio, is Governor Mike DeWine. Governor, good afternoon to you.
Good to be with you. Thank you very much.
How you doing?
I'm doing well. It's an interesting time for all of us. It's a different time. Nothing like this, I guess, in 102 years. So it's a different time for all of us.
Certainly is. I'll ask you more about that in a minute and how you're doing. But let me ask you now, you have talked about reopening the state being a bit of a gamble as things continue to roll out over the next couple of weeks. How much do the odds increase that more Ohioans will contract coronavirus?
These are all tough decisions, and it's a risk, whatever we do. It's a risk if we just keep the economy shut down, because we know that there's not only economic consequences, people unemployed, but there's medical consequences, there's health consequences when the economy goes down like that. So we've got to try to do two things at once. We've got to try to come back economically, open things up. But the virus is still here. It's not gone away. Ohioans have been great so far in how we kind of stay our distance, do what we have to do to try to reduce the spread. But as we open up Ohio, as people do more things, as they move about more, the risk certainly dramatically goes up. And that's why I've said that this is really probably, in some respects, the most crucial, the most important month ahead of us. And, how we continue to try to keep that distance. I mean, for example, my wife, Fran, made this mask, and we're all kind of having fun with different things. Of course, that's with the Browns, but it is serious. And what we encourage people to do very much so is, if you go out in public, wear something. Cover your nose, cover your mouth, and it's not so much that protects you. Frankly, it protects other people, and if everybody does it, we're each protecting each other. And so, we've got to really slow that spread down. It's particularly more difficult the more we move around.
Let me just make sure I understand this correctly. Do you expect the numbers to significantly go up, number of cases to go up, marginally? How would you characterize it?
I don't know. I'm looking at a lot of data every day. The data lags. So if you look at hospitalization, that's probably 3 to 4 weeks behind what actually happened when that person got infected. Look, we're also looking at things that are public, anybody can look at. For example, the Ohio Department of Transportation keeps track of, how many cars are going by certain spots. So what we've seen in the last couple of weeks is what you would expect, an uptick in the number of cars going out and people moving about. And so you just know that people are moving about more, and that's okay, but people have got to remember to even be more careful. I mean, early on, we didn't even say, wear the mask. And people have looked at me and said, Mike, well, if it wasn't important then, why is it important now? Well, the answer is, this is tougher. We're out more. We're not staying home as much. And so how we do collectively, 11.7 million Ohioans in the next few weeks, is going to determine whether we can continue to move forward and actually live with this virus, or whether we're going to be like what I saw in the news a couple of days ago that you all reported, and that was you had some European countries that had shut down, opened. Now they're starting to shut down again. And that is not what we want to see. So it is a gamble. This is a high risk gamble, but it's a gamble, and it's not good either if we don't open back up. So we got to take the chance, and we got to do it.
Governor, you announced yesterday that daycares will open on the 31st of this month. Obviously, big decisions for parents out there. But let me ask you, would you feel comfortable sending one of your grandkids to a daycare center at the end of the month?
Look, I think if I had a choice, I would not do it. Now, a lot of people don't have a choice. And so what we've tried to do is make it as safe as humanly possible. We've looked at the best science. Unfortunately, there's not a lot of studies in regard to COVID-19 and daycare, but we do know about the transmission of anything. And we know that that does occur. I mean, it's hard for 2-year-olds or 3-year-olds to socially distance. So what we've done is design daycare that's we think is designed the best in the country, fewer children per person, per adult, smaller classes, smaller number of kids. And so we think we made it as safe as we can. And of course, the other thing I would say is that the danger is usually not to that child. The reason that schools were closed down, the reason that daycare was closed down was not because we were so worried about the kids. You always worry about them. But this virus has attacked people who are older. It has attacked people who have a medical problem. And so what you worry about is one child coming in who's infected, who doesn't maybe show any signs of it, going into a classroom, and then every child in that class is infected, and they take it back to their respective families. And maybe one of those families has a 70-year-old grandfather who's living with them, and then he ends up with it. So those are the things that we worry about. I mean, you asked me would I send my grandchild. I think it would just depend on what all the circumstances were of what other care I had for that child. I mean, this is not an irrational decision for people to send their children to daycare, but they just have to look at all the choices that they have, and that's an individual choice that Mike DeWine as governor should not get in the way of anyone's individual choice. But what I should do, I think, is do everything in my power so when they send that child to daycare, that they know, in fact, everything has been done that we can do to make that child safe and to make your family safe as well.
Governor, you mentioned schools a second ago. How optimistic are you that kids are going to be able to go back to school come fall?
I don't think we know, frankly. I mean, I was on the phone with some superintendents from Lorain County this morning, and I was asked the same question. And what I think schools need to do is plan to go back. We hope we're back in school in August and September, and we're rolling. But it may be certainly school will be different. We know that the virus, barring some miracle, the virus is going to be very much with us in the fall. So schools need to be planning on, if they're in session physically, how do they do it? How do they keep distance? How do they do everything that they can? And I know schools are working very, very hard on that and trying to figure out exactly how they can do that.
Let me ask you a couple of resource questions here. First one in regards to testing. The president has said that anyone who wants to get a test can get one. Do you agree with that? And is that the case in Ohio?
Well, it's not the case yet in Ohio. The White House, frankly, has been very helpful to us in getting our testing up. And we just signed a contract for reagents, which is an essential part of really getting more testing. We're now running close to 8,000 tests a day. We want to be much, much higher than that. We now have the capacity for about 14 to 16,000 a day. So part of it is setting up the supply chain around the state, kind of building something from scratch. But we're going to continue to increase the testing. And really, the most important place that testing can occur is when someone exhibits signs that they might have the COVID. And then we want them to be able to get a test. If they test positive, then the tracing team comes into play from the local health department, and they simply talk to that person and try to figure out, who they may have been in contact with, and so that they can talk to those individuals as well. So we're trying to get more on the offense in regard to COVID-19 because we have more testing. We have a tracing program that we're standing up across the state. So that's one thing that we can do to get a lot more aggressive.
You've been getting kudos nationally for the work you've done here in Ohio. In fact, a Washington Post poll this week showed you have the highest approval ratings among governors in the way you've handled this, 86%. President Trump gave himself a 10 out of 10 in self-evaluating how he's handled this. What grade would you give yourself?
I'm the worst judge, but I will tell you I wake up every day and go to bed every night, and I think, what else could we be doing? This is an awesome responsibility. I have a great team. I have people who are doing amazing things. But every single day we ask ourselves, what else can we do? I was on the phone this morning, for example, with our director of prisons. I was on the phone with our director who's focused on our nursing homes. And, those are two areas that we worry a lot about. And we want to bring more testing into our nursing homes, for example. We're trying to pair off every nursing home with a hospital in the state. So a lot to do, and we're at a very crucial part. I mean, making the decisions to shut down the state seemed like gut-wrenching decisions. These decisions, as we open up and as we try to figure out how do we stay ahead of the virus, these are even tougher.
When members of your own party fight you on this, does it make you mad? Does it hurt you? What word would you use to describe how you feel?
When people talk about the polls, my wife Fran always looks at me and she says, what goes up will come down. And, she and I have done this for 40 years. And you can't, as governor, go through a crisis like this and pay any attention to what the polls are saying. You got to listen to people. You got to try to be responsive. But in the end, you got to make your own decisions because, ultimately the buck stops with me. Some people have criticized my health director. Look, she's doing a great job. And, if people don't like the decisions, I'm the one that they need to be, directing their anger towards. And look, I understand that. People are anxious to get Ohio back open, but we also have to protect Ohio lives. And what we don't want to do is go backward and have to close things down again.
Governor, as you pointed out, as we all know, these are truly scary times. It's changed the way a lot of us look at life, the way we've looked at ourselves, the way we look at others. How has this time in your life affected you?
Well, it's been a whirlwind. I mean, I literally get up at 6 and I start reading the news and reading emails and basically go all day. But from a personal point of view, it's we have 4 grandkids who live down the road. We walk down to see them at a distance. We don't go in the house. We wear a mask and we stand back and talk with them. We have 2 daughters who live on this road. We have a son who lives in the Cleveland area and his wife and their 2 kids, and we go Skype back and forth with them, or we go up on Facebook and do different things. So it's that's the part that I think is the toughest for people, being away from those that they love. And I particularly, I don't have anybody in a nursing home now, but I have a real feeling for people who have someone in a nursing home and they can't really go in and talk to them now. They can talk on the phone or they can do something virtually, but they can't do it. And that's tough. That's really tough. It's a tough time for people.
Governor, you said last week when you were asked the question, are you going to go out to eat once restaurants are open? You said you have to ask your wife, Fran. So what's the verdict? You going to go out to eat next week?
Well, we haven't been out. We've got a restaurant called the Melody Restaurant, which is near us, and they make some amazing chicken. So I'm kind of anxious to go over there, and we'll get some chicken and take it out probably and bring it back to some of our kids and grandkids. So that's going to be our big out. We also have a pizza place up here, Colonial Pizza, and we like to go there and get some pizza and take it home as well. So that's probably what's in store for us in the next week.
And as we enter this next phase of this pandemic, what advice would you have for Ohioans?
Well, look, I mean, we're in this for the long haul. This is a marathon. This is not a sprint. And we've just completed the first, I don't know what percentage of it, but the first lap maybe. So we've got a long way to go. And so I think people just need to be cautious. If you have a medical problem, if it is diabetes, obesity, whatever that is, be special, very, very, very careful. If you're over 60, 65, 70, certainly, you have to be really, really careful. Don't take chances, be cautious. And, for those young people out there who might be watching this and, who are 25, and I remember when I was 25, I thought I was invincible. My message to them is, do everything you can not to get this, because you could be spreading it to a grandparent, a parent, or someone else. And tragically, we've had, even young people where the fatality rate is not very high. But yeah, young people who've ended up in ventilators ended up in the hospital in a very difficult time for a month or 6 weeks. So this is not a virus to fool with, and we have to respect it, and we have to do everything we can for all of us to stay safe.
Governor Mike DeWine, thank you so much for joining us, sir. All the best to you.
Thank you very much. Good to be with you.